calcium, the difference between hypocalcemia and hypercalcemia. Hypocalcemia is a calcium level less than 9. Now, we already talked about hypercalcemia when we talked about oncological emergencies. So we're going to concentrate on hypocalcemia. So calcium, we need calcium in our bodies to help us develop strong bones and teeth. We need it to help us contract our muscles. It also helps with nerve transmission, and it helps blood clotting. And we need vitamin D to absorb calcium. So we should be getting some sunshine so that we can absorb calcium in our small bowels. So the causes or the risk factors include malabsorption syndromes or conditions where there is malabsorption. For example, you can use the mnemonic CHAMP KO, so knock out the champ. So C stands for Crohn's disease and celiac disease because they cause malabsorption, which can lead to malnutrition, hyperparathyroidism, and hyperphosphatemia. So calcium and phosphate live in an inverse relationship. And what I mean about that is if the phosphorus level is high, the calcium level is low, and the opposite is true. Alcoholism results in malabsorption or in malnutrition. Pancreatitis as well results in malabsorption, which can result in malnutrition. Kidney disease. So the kidney helps turn a hormone in our body to vitamin D when it reacts with sunshine. People that don't go outside or live in winter climates could have low vitamin D levels. Now, recognizing the signs and symptoms, this is what I would pay the most attention to. You can use the mnemonic CATS. Now, calcium in our body calms everything down, right? If you have calcium, you're super chill, okay? But people with low calcium are going to be hyperactive. They'll be anxious, okay? So they could have convulsions. They're going to have a present Hypocalcemia sign, and I'm going to tell you what that means soon. They're going to have circumoral, which means perioral or numbness and tingling around the mouth, okay? They can have weird perianesthesias also in their limbs, like their fingers, their toes, etc. They're going to have arrhythmias. They can have life-ending dysrhythmias. They can have arrhythmia and a dysrhythmia are the same thing, but the arrhythmia fits the mnemonic. They can have tetany because their muscles, their nerves get really irritated. Trousseau sign, positive Trousseau sign, I'll tell you what that is too. And they can have laryngeal stridor. Okay, so I want you to keep all these sheets throughout nursing school so you can refer back to them, because we're going to go into more depth when we talk about thyroidectomy in med-surg too. All right, this is Trousseau sign. It is carpal pedal spasm in reaction to placing a blood pressure cuff on around the arm, and you inflate the cuff for 1 to 4 minutes. Okay, Hypocalcemia sign refers to tapping on the facial nerve, so just below in front of the ear. If they have facial twitching on one side of the mouth, that means it's positive. Okay, so those are two signs of hypocalcemia and also hypomagnesium. So you're going to institute seizure and fall precautions. Keep them quiet. Keep the room quiet. Keep the lights down low. Remember, they're going to be anxious and irritable. You want to keep visitors out. You want to make sure there's not a lot of noises going on. If the pump starts beeping, you got to get in there and figure out what's wrong with it right away. They may need calcium and vitamin D, and you can encourage foods high in calcium. You're going to check the deep tendon reflexes because they will be hyperactive. Encourage them to eat high calcium foods like green leafy vegetables, dairy, salmon, sardines, and oranges. All right, so that does it for hypocalcemia.